Priory's new Break the Chain campaign looks at how addiction can pass down through generations and how one person's addiction can affect all their family members around them. With that in mind, I'm speaking to one of our experts today about the topics surrounding the Break the Chain campaign. So joining me is Dr Victoria Chamorro, who is a consultant psychiatrist at the Priory Hospital Roehampton. How are you doing, Victoria?
Thank you, Will. Yeah, really good, thank you.
Good. So let's start with addiction. Is there a genetic element to it? How does that work, and how do we actually know that?
So yes, there is a strong genetic element to addiction. We think it's in the region of kind of 40 to 60%. And we know that from doing studies on twins and adoptive studies. But what I really want to emphasize is that there is no addiction gene. It's kind of small changes on how we process rewards, how we process stress, how we process trauma. And they kind of all amount to a kind of genetic loading. But risk does not equal destiny. And there's lots of things that you can do to counteract that.
Alongside that sort of genetic element, you might hear people, use the word, not just around addiction, around loads of things like something like learned behaviour. So I'm guessing, is there also environmental factors, and how does that sort of play in with genetics? Is it just a quite complicated picture for each person?
Yeah, I think every person is quite unique. But if we think about the genetic factors being around that 50%, then the other factors are going to be around the environment, which is about 50%. If you're in a situation where drinking and substance misuse has been normalised, maybe that's as a child, or maybe in the work environment, or there's a lot of peer pressure or trauma. These are all contributing factors to the reasons why you might use substances. And they have a significant effect on people's ability to cope and the coping strategies that they use.
And addiction's often called a family illness. So what do you think people mean when they say that?
I think they mean that addiction never affects one person. And I think that's what the illness of addiction whispers into patients' ears, that this is only affecting them, nobody else knows, and if they can minimize the harm to everybody else. And what we know is that's just not true. Children, for example, notice from a very young age, children are quite ego-focused, so they relate the world back to themselves, and that means that they often think it's their fault or might take the blame for their loved one behaving weirdly or distancing themselves from the child. It affects the finances. It affects the relationship with your spouse. So it really does affect the whole family unit rather than just the individual.
Yeah, and it's interesting on one of the stories around Priory's Break the Chain campaign is around Jordan, and his mother's also a big part of the story, and how there's a part where Jordan says that his mother was driven to sort of breaking point.
Had hurt me, and there was things that I was shocked about.
My mum had put in there a lot about how I'd driven her to the brink, how she couldn't physically, mentally cope anymore, and she had reached her rock bottom.
And it's interesting how you must have seen this yourself many times, where it's not just the addict, obviously they're experiencing something themselves, but actually their loved ones around them are also being driven to a breaking point as well sometimes.
Yeah, absolutely. Rates of mental illness in families of substance abuse are much higher. And you can see the effect on the children if you've got a partner or a parent who is using substances, another parent who has got mental health difficulties. The children are very severely affected. Also,
with the other story around Priory's campaign, Helen, there's a moment where she sort of has what people call the rock bottom moment, and the next day her family have gone away, and her husband and children come back after a weekend away, and she says to her husband, I think I need help.
My husband and my sons came home, and I said to him, I need to go to rehab. I need to get some help. And I'll never forget the look on his face, because he was relieved.
One of the most powerful moments for my patients is often when the families write a letter. And I think there is a letter the families write that is read out to the group, and that feels very scary. It's very hard hitting a lot of the time, and it really brings the reality of the situation to the patient's mind. It's generally also done with compassion and forgiveness. So it's an incredibly powerful factor in treatment.
There's another moment in Helen's story where she talks about trauma. So she's been through a lot as a child, and
She met my first stepfather, who was an alcoholic. He was very violent. He was always beating my mum up. Yeah, and it just got worse and worse and worse. It was a really tense, horrible atmosphere.
so I'm guessing for a lot of people that can be quite a common connection as well.
For a lot of people, I think mental illness and traumatic events really drives a lot of not wanting to be alone with your own thoughts, and it seeks you to seek coping strategies that really aren't in your benefit. What I often say to my patients is alcohol is not your problem, it's your solution. And that's sometimes why when we talk about getting patients help, it feels so threatening, because what we're doing is removing the only crutch that they have to lean on, and the only way they know of coping. It takes a little bit to undo that and learn different ways of coping.
Yeah, and there's also a great moment in Jordan's story where his father struggled with addiction, and then his father passes away, and there's this quite powerful moment where he says that he knew that it would affect him, or he felt like it would be a big problem.
Using and drinking was a way to completely get out of my head. And that's something that I've literally been doing since the age of 13 when my dad died. I wanted any way possible to get out of my head, and drugs and alcohol made me happy for a long period of time until it didn't.
And that's when he maybe goes down into a spiral of addiction himself. So I guess that must be quite a common picture as well for people who are struggling with grief, and they might reach to almost that as like people often use it as a crutch or something like that.
Yeah, absolutely. I think bereavement, feeling grief is intolerable. And especially when someone so central to your life is passing away, you reach for coping strategies that feel familiar, and that might be not the most healthy ones to use. And it kind of numbs everything. And I think the drugs allow you to not feel. And that makes a significant difference to people. The problem is it's a terrible road from that point. And they, again, rather than the solution, they are the problem. It does complicate things the other side, because really you can't process the natural process of bereavement while you're on the drugs or alcohol. So the first step in all of this has to be to get sober before we can help you address the underlying trauma or bereavement or trigger for this.
And then let's maybe move to some advice maybe for family members who might be experiencing this. Actually, Priory is also releasing some survey data around this campaign as well, and apparently 26% of people are worried about a loved one's drinking. So you're talking about a quarter of the population potentially. So it's a common issue for many families who'll be watching this. Let's just start with something like if you're worried about a husband, wife, brother, sister, how might you approach a conversation with someone who you're sort of worried about the extent of their drinking?
These are really hard conversations to have, and there is no kind of one size fits all. It enters into a lot of family dynamics. It brings up a lot of very extreme emotions of maybe shame, guilt, concern, and so they're always very difficult conversations for any person, even a professional, to navigate. What I would say is always lead with your motivation, which is generally to help. I would start that conversation with, I've noticed this, and give quite a concrete example. So, I've noticed you've thrown out 5 bottles of wine this morning. It's made me quite worried about you. How can I help? Something like that, to open the conversation with something concrete that is undisputable fact, and then follow it up with your motivations and validate your position, which is you very much want to help.
And I guess there's a really interesting part in Helen's story as well, where she her drinking's getting worse, and she sort of transitions into hiding how much she's drinking a lot more. So
I tried to hide it. I would put it into a mug. I was buying boxes of wine because they were easier to conceal. I became really sneaky. And then it started to become a problem when my husband would confront me the next day. I didn't want to get any kind of negative feedback from him about it. I just waited until he'd finished, and then I'd be able to get on with my day and look forward to my wine in the evening.
it must be really sensitive for some people who are going through that they feel that shame and that kind of thing. So I guess approaching people as sensitively as possible must be really important.
Yeah, and absolutely. I think if someone's hiding something and you're, in a way, no matter how nicely you put it, you are confronting them. Giving that person time to process that is going to be really helpful. So I've noticed this. You can let them process it in the conversation, allowing a big pause, because what will feel very long for you, because you've already processed it, will feel very different from them as they go through all those rainbow of emotions. But also, that might feel very overwhelming for you. When can we talk about this? And that might be a way of providing them some emotional distance as well.
And one thing I definitely didn't realise was how important family are almost in the recovery process as well, and in treatment and things like that. So what sort of role do families actually play during treatment?
Huge roles, I think, family play. A lot of my patients will come to hospital for their families. They have realised that there is harm being caused. They don't want that to happen, and they realise that they have to be clean or sober. So that's the initial motivation, and obviously that's a huge step to seek help because of that. What I say to my patients is the motivation has to be for themselves. So they have to find what they need for themselves also to be able to progress really through the treatment. But as a hook to get people in, I think that's makes a significant difference. We also know that families being involved in the care makes a difference to the clinical, relapse rates and things like that. So I know if a family is very involved, that they have a good chance of really recovering. That said, a lot of people have had drinking or substance misuse tear their families apart, and they might not have that support when they're going to detox. And that's also okay. I have recently also been saying to patients, the treatment can't bring your family back. That might be a fact. But being sober will make you a man or a person that can have a family and to engage in that process. And that's really got to be the first step.
Thanks for watching. If you want to find out more about Priory's Break the Chain campaign, then visit priorygroup.com/break the chain.